Ryan Gosling has been at the forefront of male beauty standards for 3 decades. Has plastic surgery played a role in his appearance over the years? Let's follow his evolution. In 2001, at the age of 21, what I'm seeing is that the right frontotemporal corner is slightly more recessed than the left side, and this is the case in 90% of people. But if you look at natural patterns of the direction of hair growth, as you get closer to the right corner, usually the hair on the right side of the hairline tends to fall over to that corner, essentially allowing you to cover it up. And that's the pattern that I see with most of my hair transplant patients. Ryan also has some curvature to his forehead, and what that can sometimes do is give you the illusion of a higher hairline than you actually have. In 2002, at the age of 22, Ryan has a small dorsal hump on his nose. He also has about a 90-degree nasolabial angle. Contrast that with Margot Robbie's nasolabial angle, and you'll see the difference between a more ideal male aesthetic compared to a more ideal female aesthetic. Ryan Gosling has a flatter upper lip structure, and he has a strong lower jaw. In 2003, at the age of 23, Ryan has great eyebrow fullness. He has upper eyelid hooding with a possible congenital ptosis on the left eye compared to the right. Ryan also has lower eyelid hollowing, and he has that prominent orbicularis oculi muscle at the lower eyelid. What I'm seeing are actually signs of a potential rhinoplasty, and it may have been coupled with a septoplasty at the same time. His nose appears straighter and more narrow from the frontal view. It's pretty common to combine a septoplasty with a rhinoplasty. A septoplasty is when the central partition of the nose is modified to essentially create a straighter path for air to flow. So when people can't breathe well from the left side of their nose or the right side of their nose, a septoplasty can sometimes help in the right candidate. Now, a septoplasty can be combined with a rhinoplasty to change various elements of the external structure of the nose as well. This can be for functional reasons such as improved breathing, but it can also be for cosmetic reasons, such as making the bridge of the nose more narrow or defining the tip of the nose. Once again, when I look at Ryan's nose from 2002 into 2003, the main changes are that the bridge of the nose just appears more defined, and the tip of the nose as well. There's less bulbosity to the tip of the nose. His nose, to me, appears more midline, and it appears straighter and more defined than prior. In 2004, at the age of 24, what I'm seeing here is that Ryan does have a prominent left ear. It tends to stick out a bit more than his right side. The left ala of his nose is larger than the right. And some people end up getting alarplasty procedures to try to adjust the nostrils and to make the alas more symmetrical. And what I'm noticing in this photo here is that there's some missing beard hair on the left medial cheek. And this is something that you'll see in years to come as well. There is some missing hair as well on the right medial beard, but on the left, there's less density. In 2006, at the age of 26, there's more facial fullness, and this is particularly true in the medial cheeks, and this could potentially just be a result of some weight changes that have occurred. You can also see that Ryan has a very prominent and strong brow ridge. This is quite a masculine feature. And when you look at his nose from the profile view, you can see that there's columellar show. It's a good exercise to try to differentiate columellar show from alar retraction. Both can give the appearance of a heaviness down at the bottom of the nose, but alar retraction is when you actually have a lifted ala here. The rim of the ala is actually lifted, and so it looks like you have more nostril show. It's not so much that your columella is hanging low. Alternatively, like in Ryan's case, the ala is in a very natural position, and you can see that there's some prominence to the base of the columella here, or the base of his septum. In 2007, at the age of 27, I'm noticing that the forehead and the glabellar rhytids are more pronounced. And in 2010, at the age of 30, I'm seeing some signs of a potential brow lift. Now, when you look at the shape of his eyebrows, the medial portion, or the portion closer to the center of his face, is more lifted now compared to the year prior. His eyes now appear more open. But you can notice that the upper eyelid ptosis specifically on the left side, still remains. People get brow lift procedures generally to look less tired and to rejuvenate the eye area or the periorbital area. And in men, you have to be very careful when doing brow lifts because you don't want to feminize the face. And that can be a tricky balance because you want to lift the brows so that there's less heaviness on the eyes, but at the same time, you don't want to create too much arching of the brows either. And in 2011, at the age of 31, what I'm seeing is that there are really no signs of increased forehead height despite the brow lift, because most brow lifts will actually increase the forehead height as the hairline gets pulled back. And this is true even with endoscopic approaches to brow lifts, which are some of the more modern approaches, but they still have the potential to elevate your hairline or to increase the forehead height. And I'm not seeing that in Ryan's case, which is great. And his hair, as he enters into his 30s, is still looking fantastic. To keep your hair looking as optimal as possible, make sure to check out feelconfident.com. In 2012, at the age of 32, I see no change, and that's the same through 2016. In 2017, at the age of 37, I'm seeing some signs of potential lower eyelid filler. He had previously addressed the upper eye area, and now the lower eye appears less tired as well. And now that the lower eye area has also been addressed, he appears even less tired and more alert. In 2018, at the age of 38, what you can see is that Ryan has a more pronounced upper nasal rhytid. This horizontal crease that runs along the upper part of his nose is caused by the procerus muscle. This is a muscle that lives right here at the top of the nose, right at the bridge, and it runs vertically. And that's what we see with all lines and deep wrinkles of the face, is that they're running perpendicular to the belly of the muscle. In 2019, at the age of 39, I'm seeing the potential introduction of cheek filler, especially into the medial section. So oftentimes when we age, the cheek falls down and into the middle of the face. And that's the general trajectory that it has. So it can sometimes be more obvious when people get filler placed into their cheeks that's being done more into the central part as opposed to out here into the lateral part of their face. In 2022, at the age of 42, what I'm starting to see is that now 12 years later, after his brow lift, the brows are again starting to sag. And now they look close to their pre-brow lift position. And that's what we see with most types of lifts. Even if it's done really well, after about 10 years plus, there is a sag that occurs inevitably as we all age. So whether it's a facelift, a brow lift, a lip lift, most types of lifts will start to fail eventually. And some people go back to get that procedure repeated to bring them to a more rejuvenated, lifted state. Nothing lasts forever. And in 2023, at the age of 42, I also see no change. And the total cost of these potential procedures is $75,000. Don't forget to subscribe with post notifications to never miss a future upload. Since you like this video on Ryan Gosling, make sure to check out our video on his Barbie co-star, Margot Robbie.